Welcome to this week's edition of Health Check, where myself and colleague Dr. Nosipo give you your weekly reminder to check in on your health. So join us in conversation on all our social media platforms at Health Check SA, where we engage on our health discussions with you at the comfort of your home. Now, for many, a person's weight is a private matter that deserves no further discussion. But in extreme instances, it can put a person's health at risk. So today we're discussing obesity, a disorder involving excessive body fat that poses numerous potential health risks. The issue is rampant in South Africa, with at least half of the population being classified as either obese or overweight. My colleague, Dr. Nosipo, has gone to do a health check with one such person.
We're here in Vosloorus, where we're about to meet Mapriti Ngola, who's been struggling with her weight, that a lot of us and our family members struggle with. Let's go check in with her and hear her story.
Yazi mangikhula ngisidudla manje ngislimile bengisidudla and ngithanda ukudla sibangcono kakhulu yabona nalo yamshini ekuseni ya mangivale kakhulu ngiyazifaka la faki lona uthi ngizofule ngingazama ukuthi ngisinqashe ukudla mina nguPriti elinye igama ngonomsisi wakanxola.
Siyabonga ukusamukela namhlanje mama. Bena ukhula mama ungasitshela ukuthi impilo beyinjani when you were a child?
Yazi mangikhula ngikhule ngisidudla. Manje ngislimile bengisidudla and ngithanda ukudla. Hayi bokungekho right noma sigijima bengakhona ukugijima ngithi. But ngaya so banginika amagama. Bathi isidudla amafehle simamfuba fobeli nje amagama amaningi asinaki. So bewangangiphathi kahle and masamba nentanga zami bokuyime ngathi ngimdala nabo mhlawumbe sisikhulile nyana abafana mabasishela mina bebangifaba bengishela abantu abadala.
Bokunjani ukusakhula?
Hayi ekhaya besiphila kamnandi ukudliwa bayambe kasithengela ukudla amabhinya bekuseni kudla kunamafishi kunayo yonke into bekuthengwa ekhaya ukudla besihlala sinokudla besingasweli ukudla.
So vele since umncane iweight bekuyinkinga.
Hayi bekuyinkinga kakhulu. Manje ngislimile bengisidudla and ngithanda ukudla. Noma ngiyothenga impahla usisi wami kancane ngomzimba. Uthola ukuthi uyangena emafushini yabo. Mina impahla mangithi ngiyaqoka ziyadabu and ngifuna lezi ezincane zabantwana. Ngiyakulezi zabo mama ngoba ngistudla. Uthola sengikhala phakathi kwempahla.
Ekhaya nje ukuthi usisi wakho bekangathi umncane ngomzimba bekuwe noma nomama bekamkhulu bekuwe wedwa ekhaya bongathi umkhulu ngomzimba.
Okay abomamkhulu bambe babakhulu makuba mamhlanga mkhula abomamkhulu bebayidudla wabambe kangamkhulanga kakhulu.
Then waqala nje ukhula kuhamba impilo bekunjani ukhula ngaleyo weight ungathi umkhulu ngomzimba wena bowenzani ukuthi uzama ukuncipha ngomzimba?
Ngingazama ukuthi ngisinqashe ukudla. Ngaya udoktor makafika wangitshela naye wangibhalela email ukuthi ekuseni ngayisikipa ibreakfast yami ngidle islayisi wami iqanda itamati ngiphuze iskim milk ngasaphuza ibisi ngidla ama-fruits ngidla ama-veg inyama ngisusa iskim ngidla.
And then in your family ke bona ifamily yakho beyiphatha kanjani ngendaba yakho ye-weight?
Umuntu bekangikhuthaza kakhulu babami angitshela ukuthi i-weight ayikho right izongigulisa. Ngizama ukuhlisa i-weight.
Bohambelana esibhedlela nje ubaba ulele khona?
Kulo nyaka ngilalile esibhedlela ngilalile for sure kayi-4. Last ngihamele ngingawa ngingakazi ukuthi nginoshukela ngawisa ushukela. Mabangithatha bangisa ka-doctor. Udoktor athe ngiphuthumise nesibhedlela angeke ngithathe even nemali yethu. Ngimsenese esibhedlela bafike bangiphuthumile. Kula-ke i-asthma vele yabo ingiphethe. High blood vele ngiyazi ingiphethe. Maka into eyangisusa la ngalelo langa ngowephansi kwakushukela and ngingazi ukuthi unoshukela.
Wawunyukile kakhulu ushukela wakho ngathi?
Bowunyukile the way idoktor wayethuke ngakhona nalapha esibhedlela the way bangigijimela ngakhona. Bowunyuke kakhulu.
Manje impilo seyishintshe kanjani ngoba ngithi lezi ezinye izipho bowuzazi. Manje ushukela into entsha and it's something that's difficult yokumanage. Manje impilo seyishintshe kanjani?
Tshintshile ngiyazama ngithi manje ukuthi nami ngiyazama ukuzincisha into eziningi. Ngiyazama nokuwokhanyana. Noma ngesontweni sometimes banokugibela itaxi. Ngithi mina anithini ngiwoke. And ngithanda icathulo eziphakeme ngoba lezi ezincane hayi ziyakhudulisana. Ngithanda ukuba yabo. Yeah.
And then usisi lo kusizayo la ekhaya ukusiza ngani yini into ekuhlulayo from day to day ngendaba ze-weight?
Uyangisiza. Umntanami omunye ushadile, lo munye use-university. So bangilandela impilo ukuthi sizohlala soyi-2. Usisi ebusuku nje mhlambe ebusuku unokuvaleka. So ukuthi kumele ngingalali ngibheke phezulu yaba nomcamela mfanele sokuthi ngiyavaleka. Uyavuka, khela amanzi, angipha amaphilisi. Uyaklina, uyanginesa nje into eziningi, uyangiphekela, ngiphakele. Angikhela amanzi ngigeze. Nje. Athi masambe mina naye sambe siwokhe nyana. Ekseni sithi nje sojiya lapha sibuye.
Coming up next, we hear from our experts, Dr. Sundip Bruda and Dr. Moresi Mahlangu. The World Health Organization has noted that obesity worldwide has nearly tripled since 1975 and accounts for about 8% of deaths globally. It's not just a problem in adults, however, with an estimated 13% of South African children between the ages of 6 and 14 being obese. Now, let's try and get a better understanding of exactly what obesity is. And for that understanding, I'm joined in studio first up by Dr. Moresi Mahlangu, who is Senior Manager, Medical Advisory Services at GEMS. And we also have Dr. Sundip Bruda, who's an endocrinologist in private practice in Johannesburg. Welcome to our show.
Thank you very much.
All right. Dr. Bruda, let's start with you. We talk about obesity. Can we just perhaps just define it for our viewers out there? What is obesity?
So, Selo, obesity is a medical condition which results from an accumulation of excessive body fat. And as you mentioned earlier, the reason for that excessive accumulation of fat in the body is due to imbalance between calorie intake and calorie expenditure. Or put it more simply, energy intake and energy expenditure. And of course, there's various reasons why those imbalances occur, which we can talk about. The problem is once that fat accumulates excessively in the body, that fat in itself has bad effects on the body.
So, Dr. Mo, there are these terms thrown around often, stoola, plus size, and that sort of thing. If you look at those terms now and, looking at what people generally talk about out there, who then would be considered obese in your view?
So, a plus size can be anywhere from a size 14 to size 40, right? And that's where you have to go and actually check yourself and say, okay, now if I'm a size 14, what is my BMI? Because you could be a size 14 and you can just be your bum because, African women tend to be very gifted in certain areas. So, or you could actually be a size 14 and be considered overweight. So it's very important for you to go and have yourself checked out. See where you are on your BMI, even if your BMI is high. Do you have any of the complications, like the high blood pressure, as they call hypertension, or sugar, as they call it in diabetes, or high cholesterol? So it's important to see where you are on that spectrum or on that line, and then take it from there in terms of adjusting of your lifestyle, and do you need any treatment?
We'll come back to those bad effects, but let's just get this out the way. People talk about overweight, obesity, and there's issues around, abdominal fat, or, as some people call it, mkaba, or, pot belly. Sure. What is the significance of all of this? And are there numbers that people should be knowing?
Yeah, so in anything in medicine, we try and standardize criteria for understanding where the disease actually develops. So the body mass index is a clinical parameter that has been defined. It's your weight in kilograms over the height in meters squared. So the height is squared, and then you take the weight and divide that by that number, and you get a number. So a general normal BMI for the average person to understand is 20 to 25. Anything over 25, the body mass index is considered overweight. And once it reaches 30 or more, it's considered obesity, the clinical condition. The reason for this categorization is to help people understand their risk. The higher the BMI, the more you are at risk of the complications of obesity, you see. So if you have a normal BMI, you'll generally have less or no complications. The higher the overweight has more complications, and then with obesity, you've got to start looking aggressively and treating it.
Okay. I'm going to put this question to both of you, but let's start with you first. How much of a problem is it in South Africa?
It's a huge problem, if you excuse the pun. The point is that obesity prevalence is increasing around the world. Currently, if you look at overweight and obesity, it's affecting about 1.9 billion people around the world. It's spreading like a wildfire because we're not addressing the causation adequately, in my opinion. In South Africa, at least 2/3 of the female population are affected. The current numbers are around 69%. It's about 35 to 39% of males. You can just check me for correction, but it's around there. So that's actually a large portion of the population.
Dr. Mo, in your world, I mean, how much of a problem is this?
So we haven't done an update of the stats currently. However, it is also a huge problem within GEMS. So it does reflect what is going on in the population currently.
Right. Well, and why should we worry about this? What's the long-term consequences of, obesity?
So there's cardiovascular risk factors, hypertension, cholesterol or high cholesterol, pre-diabetes and diabetes, which then end up with cardiovascular, so coronary heart disease, or in layman's terms, heart attacks, strokes, the complications of diabetes that come with that. So that's cardiovascular. So knee osteoarthritis, lower back problems, you see, there's gout, and then the psychological issues, and that's chicken and egg. They feed into each other.
Right.
So depression and anxiety have a higher prevalence in obese patients, but those in themselves are participatory in the causation of obesity, you see. Right. So it's a very complex field that forms around.
Dr. Mo, I mean, do we see these manifestations of obesity within the, GEMS world?
Oh, yes, definitely. So we've got what's called your disease management programs that members can register for. And I mean, just on hypertension, we're sitting at over 340,000 members registered on that one, over 140,000 on diabetes, over 140,000 on your hypercholesterol disease management program. So we see a lot of this. And ironically, one of our top cancers in the GEMS population is breast cancer. And I assume that would also speak to the high rates of obesity within women. And majority of our members within GEMS are actually female, of the female population. We are seeing quite a number of joint replacements, of back operations, admissions for strokes, heart attacks, heart failure. So we are really also seeing that within GEMS, the complications of obesity.
And we're going to come back because it may have something to do with the profile of the membership.
Yes.
But let's just talk about the risk factors now and causes of obesity. Your thoughts there, please.
Yeah, so as we alluded to earlier, there's excessive energy intake and less expenditure. But the causation, why do we take in excessive energy? So this can be related to various factors. Big ones are lack of education, emotional eating, workplace issues, lack of understanding. Then we got the social and commercial determinants of health in terms of what we eat, what we're exposed to. Marketing by the so-called processed food or junk food industry is a big issue.
So yes, definitely. I mean, if you look at the demographics of GEMS, we cover government employees, and that is sedentary work, and it is a known fact. So that leaves them at high risk. And then we look at What do a lot of them eat at lunch? What's easy to grab when you work in a government office? So these are contributions, and just their work environment also plays a role in this. Right. And these are something that funders sometimes we don't always look at. One of our biggest cost drivers is mental health. We have a mental health explosion within the scheme. And we saw that hugely grow in COVID. And what happened during COVID? People were at home. People were sitting in their homes. That also led to an increase in lack of exercise. Yeah. And then it's a chicken and an egg. And then how do you get someone who's depressed to now finally go and exercise? And at the same time, exercise would help them managing their condition. Right. So it's become a whole multifactorial issue that we are also seeing in the funders environment. What we've done is, over the years, we never looked at a preventative measure. How do we keep a member healthy? Right. How do we make sure people still have the quality of life that they need? So we're now moving away from that to now looking at more of primary health care and preventative funding. So what we've done is we've introduced benefits in terms of your preventative benefits that do not affect either your savings or your day-to-day benefits. So we always encourage members, go to your GP, get your annual checkup. And as part of that, check your blood pressure, get your BMI done, check your glucose levels for diabetes, check your cholesterol levels for hyperlipidemia or hypercholesterolemia. And all of these are paid out from your preventative benefits. Your GP consult, as usual, pays as per that, and all your other tests will pay from your risk benefits. Same thing, you can go to a pharmacy and also get those checks done by a pharmacy or by a nurse.
Coming up next, we hear from our expert, and Dr. Nosipho probes further in our weekly check-in.
Maprithi, sizomamela nje isifuba, check the lungs, nanenhliziyo ngithi bese sineyinkinga.
Okay.
So we're just going to do a quick check. Okay. Yes, ukuthi asthma shame isakuphethe yona. Falekile, but at least inhliziyo yona sounds fine.
Okay.
Maprithi, besicela ukubola i-medication yakho leyo oyiphuzayo.
Okay. Nice, Thando.
Kunani ngalapha?
Amapilisi ushukela. Lawe asthma.
Iphampu yakho.
Phampu yami. Lawe high blood. Lawa uyinga 20 angicalisa ya iphampu futhi nale awe
asthma nawo lawo.
Lawa yila
Awe high blood now.
Yeah, no high blood, no blood. Lawa mapain.
Okay, awa mathambo.
Yes.
Kodwa lezi ezinye ngoba umzimba sowunciphile sokuba ngcono.
Sokuba ngcono namadolo bowangiphatha. Awasangiphathi.
Beyakuphatha kanjani amadolo ngesikhathi usinda kakhulu?
Bengakhona ukusuma la isofeni. Kufanele abantwana bangidonse. Ngoba abuhlungu amadolo.
And ubona ngathi lezi zinto lezi zikhipha positive ukuthi ucabange kahle nokuthi ufisa ukuphila.
Yes.
Abantwana bakho bona ke grandchildren, are you looking forward to playing with them izinto ezinjalo?
Ngibathanda kanjani abantwana bamntana. Makuvala igolo bayeza la. Ya, ngiyabathanda kakhulu. Ngibakhulisile futhi. Ya, ngiyabathanda. Ngibathanda ukudlula umama abo manje.
They keep you fresh, I'm sure.
Yeah, bayangijimisa, bangihlekise. Ngihlala ngihleka makubakhona.
So you have a lot to look forward to in life.
Yes.
As we wrap up, I just would like your final thoughts on obesity. Is there hope out there? Let's start with you, Dr. Morris.
So there is hope. I think the problem that we've always had with regards to obesity is the shame that people have and the stigma and the judgment. And you'll find that not everyone is willing to come forward or to seek help because we still have that shame and that judgment around obesity. However, GEMS is looking at a way of introducing some form of benefit in the future, maybe around 2025, to look at obesity holistically. So, I mean, right now we've got all of the complications divided in terms of disease management programs, but rather let's look at it holistically, almost similar to the offering we have with bariatric surgery in terms of we have your care coordination with your GPs, your specialists, your dietitians, your physios, your biokinesticists, and manage that member as a total ecosystem. And from there, we should be able to have better health outcomes, increased quality of life, and give members back their self-confidence and just be healthier going forward.
Your final thoughts?
Yes, there is hope that we can treat obesity, but we've got to be humble enough to admit that if the effect of obesity as a mass pandemic is worsening, then we've got to relook at the causation. And maybe there's some learning from obesity. Are we living in a close and wise relationship with the environment? Are we doing what we ought to do as a species? There's a lot of learning there, I think, in our choices, in our structure of society, and our trajectory as a species. Negative things happen to sometimes help us recalibrate. And I think we have the humility to learn from the pandemic rather than fight it, per se, That's important.
It's clear that South Africa still has a lot to do in turning the tide of obesity around. But as seen in Dr. Nosipo's check-in, there's still plenty of silver linings for those dealing with this disorder. We hope that Health Check has helped you check in with your health. Should you think you know someone who might be battling with this disorder, please reach out to us on social media and tell us your story. We're at Health Check SA on all social media pages. And until then, stay healthy, stay vibrant, and check in on your health.